So India Health Fund was set up 4.5 years ago as a partnership between Tata Trust and the Global Fund.
Right.
And it sort of made sense for the world's largest investor in communicable diseases to partner with India's largest non-government player in public health. But when they did, it was not to set up another organization that would run programs for the control and prevention of communicable diseases.
Right.
It was on a very specific and rather unique thesis that communicable diseases had over time suffered from market failure. And the market failure was primarily in the availability of patient capital and funding that was needed to take promising science and technology from lab to market. And this was very different from what was happening in non-communicable diseases, where there's been a lot of investment in science and technology, which has brought massive improvements in diagnosis, treatment, and prevention for just about every NCD.
Right.
And the impact on patient outcomes is very clear. Whether it's in the area of cancer, diabetes, cardiac care, stroke prevention, orthopedics, you name it. Not the case for communicable diseases, because over time these had become diseases of the poor in developing countries, funded either by governments or not-for-profit. So there just wasn't enough return for industry to make the kinds of investments to generate the returns that they sought.
Right.
And that was the thesis behind which India Health Fund was born.
Right.
So India Health Fund was set up in India with the intention of leveraging both the scientific know-how as well as the entrepreneurial ecosystem in the country, but also to leverage the design for value capabilities that we have in abundance in the country. Because the problems of LMICs are not that different. And the philosophy behind India Health Fund has always been India for the world. So that's, I think, where the origins of India Health Fund lie. As I mentioned, seeded and supported by Tata Trust with a lot of very strong engagement from the Global Fund. And our approach is really focuses on de-risking the development of promising science and technology to enable its transition from lab to use. But for us, innovation is a means to an end. And we really use the support we provide for the development of these solutions to then bring about the transformational change that we seek to catalyze by enabling partnerships and collaborations, which not only support the development of these solutions, not just by way of funding, but also technical support, but which also then enable their adoption and scale in both the public and the private health systems. And in doing this, bring the right kind of support with the right kind of partners, not just for the innovations in themselves, but for the larger cause of improving outcomes in diagnosis, treatment, and prevention of communicable diseases, using technology as a means to an end. And eventually bringing the focus back on communicable diseases, which I think we have, the one thing we have COVID to thank for is that communicable diseases have now, there is a greater understanding of the need to control communicable diseases, given the disruptions COVID has caused, and also to bring more funding into the sector, not just for development, but also for programs, but using technology as a means to an end in order to bridge both the resource as well as the capability gaps that exist in the larger area. So that's just a little bit about who we are and what we do. And in terms of focus, to address the last question you had asked, our priority is to identify technology-driven platforms which can be adapted to address the needs of different diseases, specifically for screening, for diagnosis, for infection control, care pathways, both for remote as well as point of care, and the use of data and analytics for decision support as well as for surveillance in the broad area of communicable diseases. So, Ronika, I think the focus on emerging technologies is very much in IHF's DNA.
Right.
So we probably pick up what several frontier technologies, if you can call it that, which have still not gone beyond nascent or possibly early proof of concept.
Right.
We tend not to be involved in the development of technologies that have become mainstream. And the reason for that is, again, going back to the thesis behind which we were created.
Yep.
There is an unmet need in the diagnosis, treatment, and prevention of communicable diseases. And a large part of that need gap can potentially be bridged by using technology to overcome both the financial resource gap that exists in the physical infrastructure, but also the human resource gap.
Yeah.
But with a particular focus on last mile delivery of care at the point of care, last mile primary care.
Yeah.
And that's what our focus is on. So while we remain focused on, I think, emerging technologies which can take particularly diagnostic, screening, and prevention to the point of care in primary care.
Yeah.
I think the way we look at technology, in whether not just the technology, but the solution that the technology is enabling, can have a significant improvement in outcomes, either for diagnosis, for treatment, or for prevention. For one or more diseases.
Right.
And can that be done in a way that's more affordable, easier to use, and much more flexibly than available solutions? Given how ubiquitous digital solutions are now becoming, I think we're increasingly making sure that any solution we support is also digitally enabled. Because that also aligns with, I think, now the increased focus of the public health system on digital health. With the digital health mission on the one hand, the digital ID, and so on and so forth. But it's still a nascent area.
Right.
So with digital health, it's not just about developing a solution, but making sure it's then possible to integrate it within the larger ecosystem, and that's where systems interoperability comes in, integration opportunities, the ability to use it on a standalone basis, as well as last mile in low resource settings, either with poor bandwidth, poor networks, or by health workers who can use these solutions with minimal training.
Right.
So I think those are all design considerations that are now increasingly to the fore. And lastly, in the case of digital health, given that the adoption pathways are not as well defined as in traditional diagnostics, it's important to have good evidence for a digital solution. Because the regulatory approach is still evolving, as you know. So it's even more important not just to have good evidence, but good use cases which can become the basis for a good financial case for whoever the end user is, whether it's in the public or the private system, to adopt these at scale. And that's all that we're increasingly active in now. Sure. So, see, partnerships and collaboration are at the heart of what we do. Because, I mean, you referred to the graveyard of public health. And in order to avoid falling into that graveyard, the approach we've taken at India Health Fund has been, first of all, to set up partnerships and collaborations with stakeholders that represent just about every area of relevance. Whether it's end users, whether it's academia, whether it's government, whether it's policymakers, private sector, public sector in India and other parts of the world. And I think these collaborations and partnerships we have set up have given us access to subject matter expertise. And these subject matter experts have helped the IHF team identify areas related to communicable diseases where solutions are either inadequate or not available. And as a result of that, the IHF team has been able to not just, one of the things we do is support development of innovation.
Yeah.
But more importantly, having identified the need gaps, we've been able to be much more focused and targeted in identifying what kind of solutions we need and the enabling technologies behind them that we should be focusing on. So that's the one. The second thing that we do is, as a result of that, develop very specific briefs for innovators, scientists, and organizations, so that they're not working in a vacuum, but they're working to address problems that are clearly need gaps that are clearly articulated by end users, whomsoever they may be in India or in other parts of the world. And that creates a bridge between development and deployment.
Right.
So that when we have, I think, a good match between what a user needs and what a developer is working towards, we're then able to make sure that all of the necessary stakeholders remain aligned, not just in what is being developed, but how it's being developed.
Right.
Because then all of our partners kick in to provide the right kinds of inputs, addressing the challenges that have been identified, and make sure that the development journey is more by design rather than by accident. As well as any evidence that is needed, it's sort of tailored. Any pilot scale initiatives that are needed to develop proof of concept and to generate that evidence are tailored to meet the needs of the end user. And then, of course, adoption and scale up. And we also make sure that enables the right kind sources of funding to be available at the right points of time.